Hello, everyone. Dr. Mercy here to continue to talk about mental health issues, your mindset. How are you feeling? I hope you're feeling great. I hope you're doing great. It's all about how you're feeling with me. Let me know how you're feeling and let me know if you've been taking care of your mental health. I hope so. Whether you have a diagnosis or not, please, it is our responsibility, all of us, to take care of our mental health. Let us continue our A to Z series of words, choice of words for mental illnesses. The A word was anxiety. I picked that one. Now, through your emails and calls, you guys picked the B word, which is bipolar disorder. Talking about emails and calls, we appreciate all your emails. We return all your calls and we will continue to respond to them as they come. Thank you so much for trusting us with your mental health exploration, discovery, concerns. It is a journey. Let us ride well together. Okay? Thank you so much for that. Continue to call us 682-376-6776 or email us at mercy@allmercypic.com. It is always a pleasure with us interacting with you guys. So, your B word is bipolar disorder. I cannot wait to see your C word of choice. I cannot wait. It is interesting going through all the messages and saw that, okay, bipolar disorder was the one that was most recommended by many of you. What is bipolar disorder? I like calling it manic depression, and you'll see why in a little bit, why I call it manic depression. It is commonly called bipolar disorder in most clinical settings. It is a disorder that causes your brain to change your mood, to change the way you feel, to change the way you behave or act sometimes to the point that your reasoning capacity or your logic is being compromised or is being questioned. There is no specific thing that has been known to cause bipolar disorder. However, genetics has been shown to play a contributory factor to it. Now, I'm not saying that if your family or your immediate family has bipolar disorder, it means that you have bipolar disorder. I am saying, however, that you are at higher risk of having bipolar disorder if you have a close family member with bipolar disorder. You are at higher risk of potentially having bipolar disorder. So when you start having depression, also mood swings, please seek professional advice so that we can go through the assessment. The earlier you catch it, the best treatment options we can have for it, right? Also, environmental factors have been known to influence the cause of bipolar disorder. More specifically, as well, is neurochemical imbalances, which have been known to generate bipolar disorder. What does bipolar disorder do? This is why I call it manic depression. You go through a phase of intense emotional chaos. Most of the time, you cannot even control your behavior or your thoughts or your actions during these periods because it becomes intense mood swings. You have some highs and you have some lows. You may be manic or you may be depressed. That's why I call it manic depressive disorder. You may have periods of racing thoughts, extreme excitement, euphoria, elevated mood, risk-taking behavior, impulsivity, heightened self-esteem to the point that it becomes grandiosity, flights of ideas all over the place, so elated. And next minute, you may be having persistent sadness, loss of pleasure in activities was once enjoyed, depressive episodes that will not go away, crying, sad, low mood, isolation, disturbing thoughts, including even thoughts of not just self harm, but suicidal ideation. So, you can see it's high and it's low. It's high and lows, high and lows. We want it to be stable. We want you to have that plateau, to have that stability. Now, does that mean that when you have that stability, you do not seek help or you do not continue treatment? When people are up here, they realize the need for treatment. When people are down here, they realize the need for treatment, or someone else help them get the need for treatment. When they are here, when they are stable, most of the time they may think they do not need treatment because they are between the manic and the depressive episode, they are stable. No, at this time, you still need to continue your treatment so that you don't go up and you don't go low. And even when you still take treatment, sometimes you may still go up or low, but then we can manage that better as we go. Today, before I dwell on the kind of treatment options and dwell on when to seek help, I want to say this. I really don't want to call it the benefits of bipolar disorder, but I want us to look at it in another perspective. I want bipolar disorder to be looked at into another small perspective. Yes, we have agreed that the condition is complex. It is debilitating. It is very challenging. I want us to look at it in another perspective of some pros of bipolar disorder or of having bipolar disorder. The first that comes in mind is creativity and productivity. Some individuals with bipolar disorder have experienced heightened creativity and increased productivity during their manic or hypomanic periods. They find that outburst of energy, that elevated mood, so long as they are not psychotic or they are not having a complete breakdown and become illogical, they have been stimulated to have more intense creative ideas during that moment where they have succeeded in having creativity or an increase in productivity in creative milieus like artistry, writing, and other endeavors. That manic period gives them a sense of motivation, of innovation. The ideas are popping out and they are able to excel. Research has even shown that most of the industries that deal with creativity a lot, some of their workers, especially those on top, especially those who are so smart with that creativity, some of them have bipolar and they have been known to generate more productivity during that manic phase. Another pro of having bipolar is an enhanced empathy and understanding. Because bipolar patients go through all these high and lows, emotional swing, emotional roller coaster, they have been able to show more empathy. We have seen this even in group settings during therapy. They have been able to show more empathy and more understanding towards their peers, not only those who have bipolar disorder, but towards others who have other mental health issues as well. They go through a lot of emotions that sometimes get them so frustrated, but able to curb all that and still be function in society have made them to be able to have more compassion towards other people who are suffering from mental health illnesses. So with this, they have been able to have more enhanced empathy than others. We have also seen that our patients with bipolar disorder are very resilient and they have more personal growth than others without bipolar disorder. I will say this, especially on the resilient part of it. Most of the time, when they go through those intense emotional states, and they still have to keep a job. They still have to keep a family. They still have to keep themselves. They still have to function. They have been able to curb all that, be more patient, be more resilient, be more self-conscious of what is going on, more than other people who do not have bipolar disorder. So they have gained an insight into that experience of personal growth with the fluctuation in mood, which have made them become more strategic to how they, to skills acquisition, to coping skills, and to how they face the public, because they are so challenged inside and they are able to bear that. It makes them resilient enough to conquer the outside world. And this is a plus because it doesn't only give them resilience in their disease process or in their illness process, but it gives them resilience in other areas of their lives. Another pro that I will say I have seen with bipolar patients is that they possess a source of advocacy and support, a lot of it. They can better understand what mental health patients go through. In practice, we have seen where they become better advocates of laws, of policies to be allocated to mental health patients, because they can verbalize easily what they go through. They can explain from experience what they are going through, and they can provide the much needed prompt and appropriate support to others. And this benefits the whole society as well, because we want positive change in the society. They are there to give that positive change. Not only that, we have also seen a heightened self-awareness of people with bipolar disorder. They understand their own strengths, their own limitations, their health more effectively. With this self-awareness, they are able to cope in different milieux in the society than other people who do not have bipolar disorder. Now, that being said, please, this topic should be approached with much more sensitivity, respect, support as well. Let this little pros, or let this positivity that I am saying not negate the fact that it is a struggle to live with bipolar disorder. Let these little wins or gains or advantages not outweigh the challenges that these patients go through. It is a serious thing. Professional help is always required. So a very supportive network with respect is always required. And please, we should treat them like we treat any other mental health patient, even though we can say that we are seeing some strengths in their diseases. This strength should never at any time minimize or diminish the struggles that they go through. Stay tuned. I am still going to talk about your B word, bipolar disorder, which I love to call manic depression. Stay tuned for more in-depth into it, when to seek help, and what kind of help is available out there. Thank you. Again, it's been Mercy with All Mercy, PIC.com. Thank you so much for watching. Stay tuned. Bye-bye for now.